The gentleman from Campbell, Ms. Byron.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, House Bill 1419 would end Virginia's status as the only state in the nation to mandate a vaccination intended to prevent a disease that is not transmitted through casual contact. For those of you that were not here in 2007, I will briefly give you some history on the actions that were taking place then. Before I begin, because I'm not a doctor, and I don't think most of you in this room are, I would like to reference the source of data that I'll be using in my comments. They come from the Law and Policy Director at the Genetics and Public Policy Center in Washington, D.C., also a research scientist in the Berman Institute of Bioethics at Johns Hopkins University, associate professor of pediatrics at George Washington University School of Medicine, Health Sciences in Washington, D.C., an associate dean at the Professor of Global Health Law, the faculty director of the O'Neill Institute for National Global Health Law, the director of the Center for Law and Public Health at Georgetown University Law Center in Washington, the New England Journal of Medicine, and then information from the National Council of State Legislatures. The HPV virus is the most commonly sexual transmitted infection worldwide. Although most HPV infections are benign, 2 strains of HPV cause 70% of cervical cancer. 2 other strains of HPV are also associated with 90% of genital warts. In 2006 of June, the Food and Drug Administration approved the first vaccine against HPV. Sold as Gardasil, the vaccine is intended to prevent 4 strains of HPV associated with cervical cancer: precancerous genital lesions and genital warts, strains 6, 11, 16, and 18. Another manufacturer is still awaiting approval from the FDA. Following the FDA approval, the National Advisory Committee on Immunization Practices recommended routine vaccination for girls ages 11 through 12 with 3 doses of the HPV vaccine. Even after recommendations by the ACIP, school vaccination requirements are decided mostly by state legislatures. Thereafter, state legislatures around the country, spurred by an intense lobbying campaign by the manufacturer of the vaccine, engaged in an intense effort to pass laws mandating vaccines of young girls against HPV. And those of you that were here will recall that this bill was hastily spearheaded in a short session just like the one we're in this year. Although several of us voted against this measure and tried to debate the policy, nevertheless it passed. I'm very thankful that Delegate Peace offered an amendment for an opt-out provision on the bill during this session. Although opt-outs can be very confusing to parents and not always made clear. The Michigan Senate was the first to introduce legislation in 2006 to require the vaccine for girls, but the bill was not enacted. Ohio also considered legislation in the late 2006 to require it. That also failed. The governor of Texas used executive orders to mandate this vaccine, but it was overturned by the legislature. Legislators in 39 other states and D.C. have introduced legislation that would require, fund, or educate the public about the vaccine. Only 18 states enacted legislation that basically funds, advocates, encourages the public, or encourages further studies on the vaccine, but Virginia is the only state that mandated the vaccine. Now, I don't know if we're a medical body that knows more than the others, but that's striking to me that we're the only state that decided to mandate this vaccine. Mandating vaccination as a condition for school entry began in the early 1800s and is currently required by all 50 states for several common childhood infectious diseases. Nonetheless, state efforts to mandate the HPV vaccine in minors have raised a variety of concerns on legal, ethical, and social grounds. Unlike other diseases for which state legislatures have mandated vaccines for children, the HPV is neither transmissible through casual contact nor potential fatal during childhood. It also would be the first vaccine to be mandated for use exclusively in one gender. However, you may see future legislation as there is lobbying effort to have the same mandate for boys for treatment for genital warts. While the emergence of an HPV vaccine reflects a potentially significant public health advance, particularly in developing countries which lack the health care resources for routine cervical cancer screening, the vaccine raises several concerns. First, the long-term safety and effectiveness of the vaccine are unknown, and serious adverse events reported shortly after the vaccine's approval raise questions about its short-term safety as well. Second, the legal and ethical justifications that historically supported state-mandated vaccines do not support mandating the HPV vaccine. Specifically, the HPV does not threaten an imminent and significant risk to the health of others. Recently, the FDA required changes made to the labeling and warnings information for a second time to advise of the different reactions that can happen within 15 minutes after administering the drug. There were numerous reactions of patients that passed out or fainted, sometimes after leaving where they got the vaccine and entered into a car accident or other thing. Another reason why they should be having this vaccine with their doctors. Also recently in October, there was a second report from Judicial Watch, and that came from the Advanced Adverse Event Reporting System. This is a federal system, those of you that are not aware of it, for all vaccines, and it's a place where they report adverse reactions. Now, not all vaccine reactions are reported there. Of course, there are many. There's only a small percentage that actually get reported, but it's outstanding the amount of adverse events that I looked at, serious events that were reported. In 2008, these are some of the copies, if anyone wants to see them, of young girls that died after getting injected with the Gardasil vaccine. 2009, this is another grouping that was reported to the vaccine reporting system. And then just serious and non-serious reports. This is merely 100 of the thousands that you can read online. I'd be glad to give you the link. It's really amazing when you start to read and you see similarities, but yet in the medical community, unless there's something concise, they don't always link them together until they have to. But I've heard from parents all over the country since I put the bill in early so that people would be aware of it. I've had parents contact me, and you go and try to talk to one of them and tell them that their healthy child that got their first vaccine and then either had dramatic seizures or other adverse reactions and even death, you tell them that their child, that it was not responsible for their death, and see if they want to take that into consideration as a state mandate, or that you know better than they do what their child should get, or that their doctor might have been able to tell them what some of those risks were before they made that decision. A responsibility that should be theirs and not ours. I got a letter from someone, and they gave me permission to briefly share some of it, because you really need to know what some of these reports have been. This person said, I've seen firsthand just how serious the vaccine side effects truly are. 3 years ago, a young woman was given the vaccine. She felt forced to receive the shot and was unaware of the side effects. A couple of weeks after receiving the shot, she began to feel unusual rolling sensations in her body, which left her feeling numb and extremely weak. Over the next 11 days, she was seen by several doctors in the clinics and 4 emergency rooms. With each passing day, it became difficult for her to find the strength to get out of bed. On the morning of January 2008, her mother was awoken to the sound of her making gurgling noise and found her unresponsive. She went to the hospital in an ambulance and released for unknown symptoms. On the way home, she went into a grand mal seizure in the car. She was transported to a hospital, and 56 seizures followed in the next 24 hours. It took 25 days in the hospital to find the right combination of anti-epileptic drugs to control the seizure. Several of her neurologists have concluded with a reasonable degree of medical certainty that the seizures were caused by the vaccine. The young woman I've referred to in this letter happens to be my sister. I'm writing to urge you to continue to fight for the repeal of Virginia's Gardasil law. And then they go on to say other things. This person is from Wisconsin. They're not even from Virginia. Ladies and gentlemen, some of these reports and other things are just another example of why it's so critical that we step back and take a look at what we're doing here. The manufacturer did stop their lobbying efforts after some of these reports came out, and all the states did not pass the bills. And I know I haven't seen, like other proven drugs, commercials promoting the use of this vaccine. Let me just stop a minute and say, there isn't a person in here that probably doesn't have a family member or a friend that hasn't been a victim of cancer. And I'm sure part of that is the reason several years ago that all of us leaped at something that was actually a cure, something convincing. And I'm not saying it's not. There are a lot of doctors that are convinced. You'll hear reports on both sides of the aisle from doctors. There's a lot of them that are convinced that this drug is the best thing for girls. And it may be appropriate for some children and not other children. But I still believe that that's a decision that shouldn't be made by the state, something that should be made by the parents, and that when they go in for their other vaccinations that they are required by law to take because there are other diseases that they can catch in an environment in school, that their doctors will jump at the opportunity to let them know that their daughter should get a vaccine that they're convinced is going to help prevent cancer in the future. And that's the biggest thing. We need to pass this bill to return the decision back to the families, back to their doctors, make this decision without the mandate of the state, that this will not stop the availability of the vaccine. You can still go to the health department. It is still on the list of drugs by the FDA. You can still go to your doctor and get this. As the New England Journal of Medicine said, how can policymakers make rational choices about the introduction of medical intervention that might do good in the future, but for which evidence is insufficient, especially since we will not know for many years whether the intervention will work or, in the worst case, do additional harm? Regardless of the reason, Virginia remains alone in mandating this, requiring a vaccine intended to prevent a disease that's not transmitted through casual contact. The substitution of our judgment for the judgment of parents is exactly the type of government intrusion into health care that America rejected at the polls last November. Parents are awake. They're aware of their health care decisions, more so than they've ever been. A vote for this bill doesn't take it off the list, but a vote for this bill is a vote for Virginia's parents and families, and a vote for government exercising restraint in the exertion of its powers. Let the doctors market this. Let the drug companies market it just like they do all the other drugs that you see across the airwaves, and put it back into the parents' hands. I hope it would be the pleasure of the House to engross the bill and pass it on to its third reading.